DIEP or tram flap is the name given to the tissue taken from the tummy, which is the most commonly used reconstruction. And this is a more complex operation with more of an investment in the initial surgical procedure in many ways, in terms of the complexity of the procedure, the time the procedure takes, and some of the risks involved. However, once that procedure is done, it gives the best reconstruction that we have at our disposal, both in terms of the lifespan of the reconstruction. It lasts for the rest of the woman's life, and in addition, it feels and looks the most natural form of reconstruction there is.
And I describe this as the large operation. It's not because we make large breasts out of it, but it means that there's often up between 5 and 7 hours in theatre, perhaps 5 and 7 days in hospital, and up to 7 weeks to recover. That's taking the normal distribution. I've had several ladies that have been swimming and cycling at 3 or 4 weeks, but I've had other ladies that have taken 3 months to recover.
A roll of skin and fat is taken from the tummy just below the belly button, with or without some of the tummy muscle, and that's taken completely off the body with its blood vessels that nourish it. In the meantime, in the chest, at the site of the mastectomy, some blood vessels are found that lie behind some of the ribs, and often we have to take a small section of rib away, and then under the operating microscope we have to stitch up the artery and the vein, so the blood vessels from the tummy tissue to the artery and vein in the chest, to bring that tissue back to life, restore its circulation, and once that's been done, it can then be sculpted into a breast.
When we discuss DIEP versus tram, there's a big difference. The DIEP doesn't take any muscle, a tram takes the full muscle. But there is something that's a halfway house in between. It's called a muscle-sparing tram. So I tell ladies that it's not up to me whether I do a DIEP or a muscle-sparing tram. It's up to their blood supply anatomy. Nature makes the decision for us. That's how I explain it. I think if a lady, from what they've read and what they've been told, says, I just want a DIEP, I don't want you to do anything else, that can be quite prohibitive. And I explain that it will depend on the scan and their anatomy